Tobacco kills millions each year. Many governments are banning tobacco advertising and promotion. But today's tobacco packaging still encourages people to use tobacco. Today, governments around the world are working to introduce plain packaging to reduce the attractiveness of tobacco products, prevent advertising and promotion, limit misleading packaging, and enhance health warnings. These actions can reduce tobacco use and save lives. Get ready for plain packaging.
The tobacco epidemic is one of the biggest public health threats the world has ever faced. Tobacco is the #1 cause of preventable death. Worldwide, more than 1 billion people consume tobacco, and each year about 6 million people die prematurely from tobacco-related illnesses. More than 5 million of these deaths are the result of direct tobacco use, whilst more than 600,000 are the result of non-smokers being exposed to second-hand smoke. Unless urgent action is taken, the annual smoking-related death toll may rise to 8 million by year 2030. Now, tobacco users who die prematurely deprive their families of income, raise the cost of health care, and hinder economic development. Now, May 31st, just a few days ago, was World No Tobacco Day. So today we discuss smoking and your health. Apart from reminding you about the effects of smoking on your health, we will also give you practical guidelines on how to quit the habit. Our expert guest panel today includes a lung specialist or pulmonologist, a representative from Cancer or the Cancer Association of South Africa, a representative from the Smoke Enders organization, and an ex-smoker. So sit back, relax, and learn from this exciting show ahead. You can be part of the show by calling us with your questions or views on Johannesburg 714-6843-6847 or 6857. Or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Sello Mutaung, and this is Health Talk.
Remains a big public health challenge for individuals and a great cause of death and illnesses. Diseases caused by smoking don't just end people's lives, they can also make the smoker's life and those around him or her miserable. Statistics show that globally each year more than 6 million people die from tobacco-related illnesses. The prevalence of smoking in South Africa has fallen over the last 20 years. However, about 44,000 South Africans still die annually as a result of smoking-related diseases. The Department of Health spokesperson Joel Maila says the government is more concerned with the health of the nation.
The health of this nation, and therefore if there is anything that we need to do as the Department of Health, it is our responsibility to make sure that we put systems in place to prevent diseases, and if one of them is to make sure that we deal with the issue of cigarettes, we will do that. And other people are arguing that cigarette companies are bringing a lot of money in terms of a tax and things like that, but they forget that on the same breath there are a number of things that are happening in terms of money getting out of the state due to hospitalization and many things like that, the problems that comes with the issue of smoking. So we need to make sure that we not just only look at one side of it, but to look at it under general, and therefore we think that it is the way to go, that we need to make sure that we deal with the issues of prevention, because we believe prevention is better than cure.
The World Health Organization Framework Convention Control encourages countries to adopt effective policies that will help reduce tobacco use. On Tuesday, which is World No Tobacco Day, the Department of Health announced that it is determined to tighten its tobacco laws that will see plain packaging on cigarette products as part of a global drive to lower the incentive for people to smoke.
Whatever a thing that we buy, we look at how attractive that thing is, and therefore we get to move towards buying that kind of a product. But we believe that if the cigarette packaging are such that there is no fancy branding, as it were, at this point in time, people won't be enticed into buying them and smoking them. But also above that, we think that if you put graphics that shows what conditions you will be, the costs of smoking that will be. It will be even more serious infective for people not to start to smoking. We believe that the plain packaging is the way to go, and as South Africa we are determined to go towards that route.
I had to a pair of messed up lungs daily on a packet of cigarettes, I would probably want to quit smoking.
South Africa was one of the first developing countries to ban smoking in public places in the year 2000, after the introduction of Tobacco Products Amendment Act. Smokers usually start to develop problems in their 30s and 40s, but even 18-year-old smokers are not as fit as their non-smoking friends.
Right, let's understand a little more about this smoking and tobacco epidemic from our special guests. And first up is Dr. Nivesh Sulal. Dr. Nivesh Sulal is a lung specialist or pulmonologist based at the Medi Clinic,
Morningside
Medi Clinic, based in Senton. Welcome to Health Talk.
Thank you very much for having me.
All right. And next to Dr. Sulal is Olivia Keluis. Olivia is the general manager of the organization called Cancer. I think everybody knows it as Cancer, the Cancer Association of South Africa. Welcome to Health Talk.
Good morning, Dr. Sulal.
All right. Let's perhaps start with you, Olivia. We're talking about, global figures. Just now we said, there's obviously a lot of people, I think 1 billion or something, that smoke. Do we have figures for this part of the world?
The figures that we have in South Africa is that it has decreased since we brought in legislation. So at the moment we are at 29% of our population are active smokers, which is a huge decrease since the legislation has come in.
How has it improved? So you're saying now it's sitting at 29%?
Yes.
And how has it improved since, that anti-smoking
Before
law was
legislation, it was
Yeah.
at about 36, so we're now at 29%.
Yeah.
And when the graphic pictures came onto the cigarette cartons, that in actual fact caused a lot of people to stop smoking, especially women.
Yeah. Talk about women, Dr. Sulal. Who actually smokes?
It's an interesting question because it used to be primarily men.
Right.
And then we noticed that women started smoking, and the incidence of lung cancer, which is one of the markers that we'd use for smoking-related cancer deaths, started increasing in women.
Yeah.
And we find right now that people who smoke are predominantly lower income countries, lower socioeconomic circumstances, lower education levels. We're finding a lot of young people starting to smoke now. And I think the biggest problem we have in terms of preventing smokers is trying to get at the adolescent grade 8 to 12 or 8 to 10 group for people that we're trying to stop smoking with. But it is a worldwide problem. And if we're talking about 30% of the population and 50 million people, that's a lot of people.
That's quite a lot, actually.
That's a lot of people. 30% doesn't sound like much. But 30% of 50 million is a lot.
Okay. And perhaps just let's put this into context now. I mean, there's what we call primary smoking and secondary smoking. Just explain that concept to us quickly.
Well, primary smoking is basically the people who are addicted to the tobacco, to the nicotine. That's smokers. And the secondary smoke is the people that are non-smokers that in actual fact inhale the secondary smoke from the smoker, which is just as deadly because those chemicals and carcinogens are actually stick to the clothing, stick to the surfaces in the air and inhaled by the non-smoker.
So what you're saying basically then is a lot more than just the 29% are exposed to smoking.
Absolutely.
It's not just those that smoke, but a lot more.
A lot more.
Now let's get back to the issue of, just now you spoke a little bit about, what sort of people smoke, low socioeconomic status, low education level, and so on. Let's try and find out why people smoke.
There are quite a few reasons. One is peer pressure, and especially when you start early. Advertising makes a huge interest in it. The fact that you've been exposed to living with a smoker. Children of smokers are more likely to start smoking. Children who are exposed to smokers are more likely to start smoking. There are a whole lot of issues about stress, psychological illnesses, psychiatric illnesses as well. But by and large, if one had to think back even 15 to 20 years ago, it was attractive to smoke. We had advertising on TV, at cinemas, sporting events, and it became pervasive in terms of advertising. And those were the reasons that people started smoking.
Yeah, yeah. Obviously, there's lots of reasons, and I think the ones that we worry about is advertising, because people get to see this, and there's other form of free advertising at homes that children and young people see from their parents, isn't that so? All right, let's come back to the issue now of the risk factors. Okay, maybe we'll talk about the risk factors just now. Let's talk about, before we go on, what do people smoke?
Well, primarily cigarettes.
Yeah.
And then, of course, your cigars. And then amongst the young people, we find a very high incidence of using the hookah or the water pipe. Has various names, hubbly bubbly.
Hubbly bubbly, they call it.
Think this is very cool. And some parents are under the impression that this is not dangerous. But in actual fact, it hasn't got a filter and it's very dangerous. So, and then they spend a lot more time on the hubbly bubbly, and they also share the pipe. So you get a higher incidence of passing on herpes virus, TB, and all that type of thing.
Yeah.
So amongst the students and youngsters, it's a lot of hubbly bubbly.
Yeah.
And then of course snuff, because it is culturally not acceptable for young black women to smoke, and therefore they use a lot of snuff.
Snuff, yeah, yeah. And of course not forgetting things like dacha and other drugs and that sort of thing. Just as finally, if we could just wrap it up, what are the risk factors for smoking? Because I think we need to understand this before we start talking about prevention and so on.
The risk factors for smoking are seeing other people who smoke. So when people are smoking, more people will smoke around them. So it's advertising, smoking, other people smoking, lower socioeconomic areas, lower education levels, and the lower income countries. And those are the numbers that we see worldwide.
Yeah. All right. All right. Okay. So how bad exactly is smoking on your health? That after the break. Please stay with us. Welcome back. Now, tobacco smoke is not only addictive but toxic as well. When a cigarette burns, it releases up to 4,000 toxic chemicals, all of which are lethal to the body. We know that 60 of these chemicals can cause cancer and many more diseases. Well, let's hear more about this from our special guests, Dr. Nivesh Sulal, a pulmonologist based at the Morningside Clinic in Sandton. And we still have, of course, Olivia Lewis, General Manager of Cancer. Dr. Sulal, let's start with you. Clearly, smoking is bad for our health. We've known this for a long time. let's just try and remind ourselves what the ill effects of smoking are on our health.
There are very few illnesses that cigarettes don't cause or make worse. So there are lung problems, and those include things like lung cancer. More importantly, emphysema, or what we call COPD, chronic obstructive pulmonary disease. Now that's an entire spectrum of disease that include things like the so-called smoker's cough, where people say, it's just a normal smoker's cough. That's early COPD. Emphysema is the end stage of that. So those are the two primary issues that we find in the lung. Of course, we find increased incidence of pneumonia as an infection, an increased prevalence of tuberculosis, increased prevalence of other lung diseases. And whatever lung disease you have, smoking makes worse, including HIV, which is obviously quite a big problem in our country. That's just the lung. Cardiovascular disease, in terms of coronary artery disease, that's heart attacks. It causes strokes. It can cause peripheral vascular disease. That's where your blood vessels get blocked to various parts of the body. Those are the cardiovascular ones. Cancer's become quite a big thing, and everyone focuses on lung cancer, but cancers of the mouth, cancers of the lip, cancers of the throat, cancers of the bladder are also predominant cancers that cigarettes can actually cause. So the 4,500 chemicals in general, all of them can do bad things to you.
Let's come back to the dose effect now. Is there anything, first of all, is there any safe cigarette or any safe smoking habit? Like, if somebody says, well, I used to smoke 10, now I smoke 2, so surely, that reduces my risk. Your comment on that?
The answer is yes and no. There is no such thing as safe cigarette smoking. One cigarette a day will increase your risk of having cancer. We do know that the more that you smoke, or the higher the dose, the higher your risk. It's like any poison. If you're exposed to more of it, your risk will be higher. So people who smoke cigarettes without filters, higher nicotine and tar contents, more cigarettes, we use various combinations of calculations. So how many cigarettes per day per so many years will increase your risks. So if one had to smoke 1 packet of cigarettes a day for 20 years, your risk of lung cancer goes up X%. We use those, but the answer is if you can reduce, that would reduce your risk. But even one is not safe.
Not safe at all. We spoke earlier about the hubbly bubblies, the hookahs, the pipes, and all of that. Is there anything such as a safe way of smoking, including e-cigarettes?
Well, e-cigarettes, people have got this idea that e-cigarettes are safe. There's huge research being done at the moment, and it was part of our World No Tobacco Day that we, in actual fact, are saying e-cigarettes are not safe. But it hasn't scientifically been proven yet exactly how many carcinogens there are. It has been advertised that it's 95% safer than smoking a cigarette. There's no such thing because it does contain nicotine, and anything that contains nicotine is a carcinogenic agent.
Talk about carcinogenic agents. Just give us a picture of what the burden of lung cancer is like, in this part of the world.
The burden of lung cancer is huge. Besides the fact that financially it drains a family because of the cost, it's a huge financial drain on the state coffers for state patients. The families usually, if it's a breadwinner, they lose the income because it's a debilitating disease. So they become ill, they can't work, they can't bring in the income. And there's a huge emotional stress also on the family because of the signs and the symptoms that the patient goes through. They're short of breath, they can't walk, their appetite decreases, and it's really very, very emotionally debilitating for the family.
And how much of it do you see?
A lot of it. We see for patients that come to cancer for support, we immediately go in and we assess them and we look at see how can we help them. If it's maybe they've just been diagnosed, we'll do the assessment and then have a look and see if they're going to go for radiation or chemotherapy or whatever. We will walk the road with them, tell them all about what their treatment entails, and after that we will then supply them with pain control and then also help them to get oxygen because they're so short of breath.
Talk about oxygen. I mean, let's talk about that spectrum of diseases lung diseases that we spoke about. Let's start with asthma. The role of smoking, primary and secondary smoking, when it comes to asthma.
It has causative effects, and we see this in children. So children who are exposed to cigarette smoke have more of a chance of developing asthma. As we said at the beginning, any lung disease that you have will be made worse by cigarette smoking. So asthmatics who smoke or are exposed to cigarette smoke that's secondhand, or the so-called side stream out the side of the mouth cigarette smoke, are more likely to be worse off, which basically means that your lung capacity reduces a lot quicker because you're exposed to cigarette smoking. So if you take someone who has asthma and they smoke at a young age, they may not smoke a lot, but their lungs will be damaged a lot more, a lot quicker. So they will end up with what looks like emphysema or COPD fairly soon, actually, because they're smoking on underlying diseased lung.
Just taking it from there, I mean, what about smoking in pregnancy? Are there any dangers there?
Absolutely. It's one of the few no-nos which are implemented a lot or impacted a lot at antenatal clinics. All things related to the pregnancy, premature birth, premature rupturing of membranes, low birth weight, so the babies end up smaller, the babies end up with more diseases, the pregnancies are more difficult. All of these things are related to smoking. So the first thing we can actually say to any woman who's smoking and pregnant is please stop immediately.
Earlier you mentioned smokers cough.
Yeah.
And there's the notion of, chronic bronchitis and, COPD and so on. Just explain that. I mean, is it normal for someone to have a cough that is termed, the guy's a smoker, so we understand why he's smoking.
There's no such thing as the normal cough. The cough is there for a reason. It's there to tell us that there's something going on in the airways. The cough is a protective mechanism. And smokers who cough and what we call chronic bronchitis are people who cough for a certain amount of time every year, fairly frequently. People tend to blame it on the seasonal sort of effect, but it's actually cigarette smoke that's causing damage to the lining of the lung. And that damage to the lining is one spectrum of COPD, chronic obstructive pulmonary disease. That means your lungs expand and you can't get air out. So you can get air in, but you can't get the air out.
And you can actually live a miserable life.
You can live a very miserable life with that.
Okay, all right. Okay, time for a quick commercial break. But before we take a break, let's look at Zimbabwean President Robert Mugabe at his comedic best on tobacco and smoking. Take a look.
Tobacco, we don't smoke much of it. The Chinese smoke most of it. Well, we produce it. WHO, and we have our Minister of Health here. He advises against smoking, but he doesn't advise against growing. And we say, well, we will grow it for those who would want to smoke it. But the Ministers of Health and WHO will say, don't over-smoke. You get nicotine into your lungs and so on, and eventually it affects you. We say, well, they should listen to what the doctors say, but we continue to grow. Here it is. Our friends in China smoke as WHO advises you. But if you over-smoke, we'll grow more. And don't blame us. And in the name of God, we will say, well, we just gave them, as our neighbors, what they wanted from us. But we didn't force them, oh Lord, to smoke.
News Today keeps you informed with news locally and around the world.
When Judge John Hlophe challenged the Supreme Court of Appeal when it sent the matter back and said that there must be an inquiry set up.
We unpack business news.
There's an increase in general inflation in the country.
We give you up-to-date news of the day.
The drugs were seized at several locations in Sydney, including a shipping container sent from Hong Kong. Police say it's the largest haul of illicit drugs in 2 years.
We round up sports news.
Kotata, tell me about the legacy that you would like to build and be remembered for.
Trying to get my foundation running, which is going to focus on, all the sport, doesn't matter disability or able body. So, I'm passionate about sports.
Stay informed every Monday to Friday from 3 to 5:30 p.m. CAT. SABC News.
Welcome back to Health Talk. Now, it is said that about 90% of people will have smoked their first cigarette by the age of 18 years. So it makes sense for us to focus smoking prevention activities on the youth. Well, let's hear more about that from our special guests. We still have Dr. Sulal, a pulmonologist based at Morningside Clinic, and Olivia Kelouis, General Manager of Cancer. And we're now joined by Wendy Gidlow. Now, Wendy has an interesting story. She's an ex-smoker and is currently quite active in encouraging other people to stop smoking. Perhaps let's start with you, and welcome to Health Talk, by the way.
Thank you, Selo.
Right. Tell us your story. You started smoking at an early age, I believe.
I started smoking in the 80s when it was very, very cool to smoke, and you fitted in and you were chic and all the coolest people smoked. Yeah. I was only 13 at the time. And I started experimenting with cigarettes to be a little bit rebellious, to fit in, to be a little bit independent.
Was it something that some of your friends were doing, perhaps?
Absolutely. So also it gave me the aspect of fitting in. Yeah. If I smoked, I fitted in with a cool crowd. Right. And it started with one cigarette every now and then, but being a very addictive substance, nicotine, I was eventually smoking 1 cigarette a day, and then eventually 5 cigarettes a day. And then I stopped school and I went into business. And before I knew it, I was smoking 20 cigarettes a day, carried on in business. And the next thing I was smoking 2 packs a day. And when I went out at night after work, I would smoke up to 3 packs a day, 2.5 to 3 packs a day.
Now that's 60 cigarettes a day.
That's a lot of cigarettes. I was very addicted.
Just hold it there, because I believe we have Vemula on the line. Vemula, welcome to Health Talk.
Hello?
Yes, your question of view, please.
I think you've taken my question already. It was about the alcohol.
Yeah.
The alcohol versus tobacco smoking, and the fact that more research needs to be done into the damage, because there is more damage done by alcohol than by tobacco.
All right. Thank you very much. We'll put that through to our expert panel. Perhaps let's put it to you, Dr. Sula. I think the issues around alcohol versus alcohol plus smoking.
Okay. I think on their own, each of them are equally dangerous. Alcohol has its own set of issues, which is also equally dangerous for various other reasons, in terms of liver disease and cardiovascular disease and things like that as well. But there is a significant link between alcohol and cigarette usage. And the combined use is obviously an increased risk of both things. Mm-hmm. So the answer is that both are dangerous in their own right. Put together, it's even worse.
Okay. All right, let's get back to your story. So you started with 1 cigarette, every now and then. It went on to 3 packs.
Yeah.
And what happened?
Well, before I knew it, as I said, I was smoking up to 60 a day. On a good day, 60. Quiet day, 40. And I carried on like this for about 15 years. But then it came to that stage of my life where I wanted to have babies, start a family. But I really felt very, very addicted. I didn't feel that I could stop smoking. I felt as if the habit controlled me completely. So I went to the Smoke Enders course and joined. hoping that it would help me. And in fact it did. And I stopped smoking 22 years ago now, and I haven't looked back. But at the same time, I want to say that...
You don't get the urge to light up for someone?
I don't. But I do want to say that stopping smoking is not easy. Nicotine is the third most addictive substance that we know of, after heroin and crack.
But you're a living example that it is possible.
But it's possible, but I want to state that it's not easy. You need to put in a lot of time and effort, and possibly even get help to stop smoking.
Let's get back to the issue of prevention, Olivia. I mean, just... when I introduced the segment, I said, obviously it makes better sense to focus on the youth, because she just said that she started smoking when she was 13. As society, what should we be doing to try and prevent the youth from even starting to smoke in the first place?
Well, Cancer has health campaigns that we run, and we start right from preschool, going through primary school, high school, universities, targeting pregnant mothers at clinics, churches, and the thing, where we in actual fact teach children from a very, very early age the dangers of smoking. We show them diseased lungs, we tell them what can happen, and we've actually, in fact, after I've given a talk at a school and shown them this, I've had calls from parents saying, "You've scared my child, please," because they've come home and told me to please stop smoking because I'm going to die. So I said to her, well, it's a fact, that you are increasing your, you are cutting your life expectancy by smoking cigarettes. So it's very, very important that we teach our children from a very, very young age. And as stated before, especially pregnant moms, I mean, the baby smokes, that it goes through the placenta, so the baby smokes and gets withdrawal. So we target pregnant moms as well to tell them about the dangers of smoking. So our health education is very, very important.
Well, if the parents themselves are, chain smokers, it's probably a bit difficult, for children to listen to them, them saying, smoking is bad for you, and they're busy puffing away. Well, what should parents be doing?
Well, parents, it is. Children lead by example, and as soon as they, most of our smokers come out of households where one or both parents smoke. So therefore it's education of parents as well, which we do in workplaces, where we go in and we, at the workplace, will show adults the dangers of smoking, tell them about how to stop smoking, give them help on a quit line, tell them that their children are going to be more prone to certain diseases. They're going to be more asthmatic. They're going to get gum ear. The mothers are expecting they're going to have a low birth weight and a lot more asthmatic cases. So it's through the whole spectrum that we have to educate our public out there.
Dr. Sulal, we've seen the issue around legislation, that it had some effect in lowering the prevalence of smoking. Your opinion in terms of what legislation can do in terms of preventing smoking?
I think it's important because it's one of the cornerstones of what we have in terms of worldwide prevention. Now, certain countries around the world have stricter legislation. For example, the Australian government right now is probably taking the hardest line in terms of packaging of cigarettes and so on. We've had what we have considered the general sort of basic standard, as in we shouldn't be selling cigarettes to under 18s, the warning labels on boxes of cigarettes. But legislation is what we have as our biggest tool right now to actually formalize doing this. There are issues right now about counterfeit cigarettes and whether legislation will put that through. I think these are not particularly sound arguments, and some would say that the tobacco companies are the ones who are purporting to make these things worse. But the less advertising we have, the better off we're going to be.
Yeah. All right. I believe we have Zanele from Soweto. Zanele, welcome to Health Talk.
Good morning, Doctor. Doctor, I smoked for a very, very long time. And I started smoking when I was 19. And I smoked because I was fat and they said I'd be slim. And I smoked for something like, I think 30 years or 40 years. I only stopped when I was pregnant. And then in 2004, I stopped working. My husband is not smoking. I stopped working in 2004. Then I decided not to smoke because my husband is working and I can't pay his money. And it was not such a problem stopping. Just decided that day that as from tomorrow I'm not smoking, and I stopped until now.
Well done. Well, thank you for sharing that story with us. Your last word in 15 seconds.
I wanted to add something. You asked about the youth smoking.
Yeah.
And it's quite a big factor that when parents smoke, the youth are not only subjected to secondhand smoke, but they actually become addicted. A baby that's born to a pregnant mother who smokes is born addicted. And therefore, when these kids try their first cigarettes, they can't stop because they're addicted.
Okay. Well, Wendy Gidlow, thank you very much for your very valuable tips there. Folk, I believe we have some tweets that have just come in. If I can just get them on the screen as soon as possible, I'll go through them before we go for a quick commercial break. Okay, the first one is...
There we go.
I stopped on the 22nd of January 2016 and still going strong. It wasn't an easy process, but I needed to. And Jake Johnson says, nothing worse than seeing young people smoking cigarettes. Fia says, yes, non-smoker boys are gold, but a smoker who successfully quit smoking is a legend. Disaster Operations says, tobacco kills 6 million people every year. Recent moves to introduce plain, standardized packaging of tobacco products can save lives. Okay, well, so how then can we quit smoking? More on that after the break. Please stay with us.
Waiting for your spot in the limelight. Step up, people of the party. We need your energy, your greatness. Just because you don't do it for money doesn't make you an amateur. So we salute you, party comrade, with a bottle of black and white blended Scotch whiskey for just $109.99 from Tops at Spa.
He appealed for the disruptions to come to an end so the future of the children is not compromised.
The union said the latest offer by Eskom will condemn its members to poverty.
Samples from the 2012 London Olympic Games and 2014 Sochi Winter Games will also be retested.
Stay tuned to News Today at 3 p.m. from Monday to Friday on SABC News.
All right, so is there a simple way that someone can quit smoking? Let's learn more about this from our guests. We still have Dr. Nivesh Sulal, pulmonologist based at Morningside Clinic, and Olivia from Cancer. And we're now joined by Messia Axon, who's the owner of Smoke Enders South Africa. Welcome to Health Talk, Messia.
Thank you, Selo.
All right. Perhaps before we start our discussion, I believe we have Masuma on the line from KZN. Welcome to Health Talk, Masuma.
Thank you very much. Good morning.
Morning. Your question or view quickly, please.
Okay. I am a grade 11 class teacher here in KZN, and I have a problem of my 5 chain smokers. They smoke in the morning. They sometimes absent themselves from school. They smoke during break. And they even bank classes for smoking. I don't know how best to help them.
Good question. Well, stay tuned. I'm sure one of our guests will try and address that. 5 grade 11 learners who are chain smokers. It has affected them so much so that they bunk classes. Perhaps let's start with you, Messia.
Oh.
All right. Before you get to that one specifically, tell us about Smoke Enders. What do you do?
Great. With Smoke Enders, we do a lot of things. First of all, we get rid of the addiction, which is not really the biggest problem. It's actually quite easy to get rid of. Then there's the habit part. But that also is not a problem because there are a lot of behavior modification processes today to change habits. The big problem is the emotional bond that smokers form with the cigarettes. It becomes their support system, it becomes their best friend. It is just the most important thing in their life because it is a drug.
That dreadful thing that you put in the mouth becomes so important.
It
All right,
does.
just hold it off because we have Eunice on the line from Pretoria. Eunice, welcome to Health Talk.
Thank you, Doctor. I'm happy to have your time.
Yes.
What I want to comment is to the viewers there because mainly it's about getting money from the viewers or the people who smoke. My comment is, as human beings, we must prioritize. We don't know the person who created cigarette, what was his motive, what was the problem. But at the end of it, we must value our health, our lives, and the precious moment that God has put us on earth.
Okay.
Now, you cannot support the vision of someone who will not be there when you are sick. It is better to stop the things that in future, at least you know that you escape it. So smoking is totally condemned because it steals lives.
Thank you very much.
Very much.
Thank you very much for your comments. Well, we value our lives, isn't that? We'll come back to smoke enders. Let's understand what cancer does to help people quit smoking.
Cancer has an online program called Kick Butt program, where you can go onto the cancer website, www.cancer.org.za, and click on the link, Kick Butt. It's a 12-week program where you will be helped every step of the way. You will click on if you want to get the emails. So every week you will get an email giving you tips, giving you encouragement on which week you are. And then also, if you are feeling that you are not coping, you have an online buddy that you can also contact.
I see we put out a number and your web address on the screen, 0800 22 6622. Is that the correct one?
That's the toll-free line.
The toll-free line, okay.
Yes.
All right. Okay.
Who will guide you to the Kick Butt program if you're not sure where it is. So as I say, it's over 12 weeks, and then as you go through the different stages in trying to quit smoking, we encourage the people to set a date and only you can stop smoking. You can't stop smoking for somebody else. You must make the decision that you want to stop smoking. You circle that date, and then you tell everybody about it, and then we teach you and we encourage you how to go through the 12 weeks. And if you do, at any stage, fail and you take up a cigarette, doesn't mean you're a failure. It means that you don't have to start from day one again. You just carry on. But we will teach you to go through this because people often do not want to stop smoking because they're afraid of being a failure.
You know, I don't like asking this question, but I have to ask it. We know that stopping smoking isn't an easy process.
No, it's not.
What is the success rate of your programs? Do you know?
It's very difficult to say because people that do not complete the program or don't come back don't often tell you. And it's just like with the Alan Carr, where people, if you go through their whole program and you're successful and you don't start smoking again, they will refund you your money. Now, very few people go back and ask for the refund because they're afraid of being a failure. Just so in our Kick Butt program, people don't come back and say, I've started smoking again. So it's very difficult to say what our success rate is, though we do have a lot of people joining.
Yeah. Smoke enders?
Well, it must be easier for us to keep track of it because, we have groups, personal instructors and so on. Because with us, if they attend all the meetings and they do their homework, assignments, the things we ask them to do during the week, if they do that properly over the 7 weeks, then we have a virtually 100% success rate. If there are people who are still wobbly, we invite them to continue with the program because I won't happily let somebody go if they're still smoking. Because if somebody walks out the door still smoking, their life is in danger.
Okay.
And
Dr. Sulel, We shouldn't forget that question around the teacher who's desperate, is looking for a solution to say, what can she do? But before that, I want you to, I'm going to come back to you. Let me take Roy from Mafikeng. Roy, welcome to Health Talk.
Hi, good morning.
Morning.
My question is to Dr. Sulal.
Yeah.
I've been a habitual smoker for a number of years, but I managed to quit using the chewing gum, what you call Nicorette, a few years ago. But then I got a relapse, and then I went back to this Nicorette. But unfortunately, I'm hooked onto it now.
You hooked onto Nicorette?
I'm hooked onto Nicorette.
Right.
I'm sort of addicted to it now.
Yeah.
So can the doctor explain sort of what are is the same health risks, or can it cause cancer, or what is the problem with the chewing gum itself?
Good question. Thank you very much.
Yeah.
Dr. Sulal?
Thank you for the question, Roy. It's an excellent question, and it's something that we actually see reasonably often.
Yeah.
The short answer is congratulations on stopping smoking cigarettes.
Yes.
And that's the biggest health benefit that one could have. Nicotine is the addictive portion of the cigarette smoking. Now, what we'd like to do is use Nicorette replacement therapy to aid stopping smoking.
Mm-hmm.
So when we speak about, I'll talk about a few things here with this as well. When we spoke about the success rates, if you try what they call the cold turkey route, so you just decide one day, I think I will stop smoking, your chances of succeeding, which is basically being smoke-free at 1 year, it's only about 5%.
Yeah.
If you take that with a program like Smoke Enders or a psychological help with that, that can go up to 15, 16%.
Yeah.
If you use some of the newer medications that you can get up to 30, 32%. These are sort of just worldwide broad figures.
Right.
What we're talking about is that with the nicotine and the nicotine gum that we've had our caller talking about, you will find that nicotine itself as a drug will raise your heart rate, will raise your blood pressure a little bit. But it's actually far better and preferable than actually going back to smoking.
Mm-hmm.
So if that is what it takes to keep off the cigarettes, go with it at this point.
Yeah.
Make sure that your blood pressure is being checked.
Okay. Please, let's help the desperate teacher from KZN.
That's a slightly difficult problem. And if I knew the answer to that, we would have solved half of the world's problems right now.
Yeah.
You've got a few problems. You've got grade 9 students. When I was in grade 9, I thought I knew everything. When I was in grade 10, I knew everything. And there was no teacher that was going to tell me anything about that. And unfortunately, that's what we're dealing with. We're dealing with teenagers who are already physiologically addicted. So they're addicted, and if they're chain smokers, that means they're getting an increasingly higher and escalating dose, and it's going to be a lot higher to try and get them off this. It's the same way we would consider it any other drug. If students were caught using dacha, marijuana, or anything like tick or cat or anything else that's going around these days, we would try and get a drug addiction program. And I think because it's socially acceptable, because it's legal to have cigarettes out there, we don't consider it in the same way. But the treatments are pretty much the same as any other addiction.
Yeah. Yeah.
And get them together, get groups together, and treat them as a drug addiction.
Yeah. We're running out of time, unfortunately. And perhaps let me give you each 30 seconds. Cancer and smoke enders. Practical guidelines now for people who want to smoke.
If you want to stop smoking, only you can decide that. Log on to our website, join the Kick Butt program, and we will be there for you every step of the way. Sergeant Kick Butt will kick your butt to stop smoking. But it is successful.
All right. Smoke enders?
Any way that you can stop smoking is a good way.
Mm-hmm.
Now, it's not simple, it's not easy, but it is entirely possible with a bit of help.
Yeah.
And I think the Kickback program is great. But if people need guidance and help and understanding and all that, Smoke Enders is there as well for them. And we perhaps go a bit deeper. The nicotine replacement way, as far as I'm concerned, is just about useless because the chewing gum also does damage.
I have to give you the last 10 seconds to respond.
Any way that can stop cigarette smoking is useful.
Great way.
Right. Okay. So, well, it's been such a fascinating discussion, and thank you so much for all of you from Smoke Enders, from Kensa, and Dr. Sulal from Morningside Clinic. Unfortunately, that's all the time that we have for this program, and that's it. If you're still smoking and you're not convinced, please try and log on to the website Cancer or Smoke Enders. Just try and get some tips there on how to kick that habit. Otherwise, join us next week on SABC News. And remember to please share your views and comments with us via Facebook, SABC Health Talk, and follow us on Twitter at SABC Health Talk. Remember that you can watch a repeat of today's show at 2 p.m. and otherwise Thursday morning at 5 o'clock, or you can get all repeats from the YouTube channel. I'm Dr. Solomon. Thank you so much for watching Health Talk. Thank you for your calls. Thank you for your tweets. And please do take care. If you still smoke, please kick that habit.